Welcome back to Afternoon Live. We're all anticipating the COVID-19 vaccines, but who gets to be vaccinated first? Here with an update is medical researcher and cardiologist. Dr. Ernst von Schwarz is back with us. Thanks for coming back, doctor. Can you hear me?
Thanks for having me.
Oh, absolutely. This is, I think, the most talked about topic, obviously, is this vaccination that we've all been waiting for months and months and months. So kind of speak to it. What are we looking forward to, and when do you feel is really going to start rolling out?
Well, as you know and heard from the news all over, there's two of the vaccine candidates who are under consideration by the FDA for what is called emergency use authorization. The first one is the BioNTech Pfizer, which was submitted for application last week, and the other one yesterday from Moderna. So the FDA is supposed to meet on December 10 to make a hopefully decision on the Pfizer product, and on December 17 on the Moderna product. So we as healthcare providers all expect and hope that the FDA will quickly turn around and might approve this emergency use authorization. And then very quickly, we should be able to get our hands on the vaccine. In fact, you might have read or heard that just of today, American Airlines, for example, equipped some of their planes with those ice-cold freezers in order to distribute the vaccine all over the country.
I'm looking at the calendar in my head, as you say, December 10th, December 17th, a quick rollout. What does quick mean, though?
Well, the FDA stated at one point that it could approve the products as quickly as between 24 and 72 hours. The FDA, of course, will talk to their advisory board, and it's not a one-man decision. It's a whole committee, basically, which will make a recommendation. But in view of the current situation with the surge of COVID infections and higher death rates, and in the last couple of months, we all expect and hope that the FDA will very quickly approve within a day or two.
And when that happens, what does that look like? Who will be the first? How many are available?
Well, you're in Oregon, for example, your Oregon Health Director released a statement just 4 days ago stating that the first 30,000 doses in your state are supposed to go to nurses and others who take care for COVID patients currently. It's a state thing, and the verdict is not clear there, but in general, the plan is right now to vaccinate healthcare providers and those in particular who deal with COVID patients first, followed by senior citizens, especially those residing in skilled nursing facility and senior citizen homes, and followed then by those which we call the high-risk groups, which is the elderly, usually patients above 65 years of age, in particular those with underlying lung and heart diseases.
So when can people like police, teachers, perhaps be looking forward to this?
That's not defined, and it's a state thing, basically. But they are considered essential workers, of course, and especially police officers and working in the prison systems, for example. They are at high risk also because they are in direct contact with a lot of people, and a lot of inmates, for example, got COVID-19. So they will be among the early group, but there's different phases. And as you know, there's some controversy about what the CDC recommends, as well as what the current government recommends, who should be vaccinated first. But we'll see. We just await the vaccine, and I will stand in line for that, and I will encourage my family to do the same thing, and otherwise we can't get rid of that virus.
Right, and then when you get the vaccination, how long until it actually works?
Well, if you look at the studies, and again, there's two things to look at. One is, of course, what has been published. And none of the large-scale data from Pfizer or Moderna have been published yet in a scientific journal. But what has been published were the smaller studies, phase 1 and early phase 2 studies about the safety. And in those studies, it showed that the immunologic response was present around 28 days after the vaccination. Keep in mind, most of the vaccine compounds require 2 vaccinations between 3 and 4 weeks apart. So within a month after the first vaccination, we can expect definitely immunologic response and probably full protection shortly thereafter.
Great information. Couldn't come soon enough. Thank you so much, Dr. Ernst.
Thank you for having me.
We'll have more information about Dr. von Schwarz on our website at kat.com.